Hello, Mr. Smith. Good morning. How are you doing today?
I'm fine, and you can call me John.
Oh, okay. I am Samuel Ogen Amoako, the student nurse practitioner. Can you tell me your date of birth?
Yes, May 5th, 1949.
That's correct. Do you have any allergies to medication or food?
None.
Has anything with your history changed since you were here last?
No.
Okay, let me review your medications. Are you currently taking any medication?
Yes, I take lisinopril 20 milligrams for hypertension and Lipitor 20 milligrams for cholesterol daily.
Good. Okay. Let me also see your immunization. On the record shows that you need herpes zoster, which is immunization against shingles or chickenpox, and you also need a pneumonia vaccine, which prevents infection due to bacteria, and then you also need a tetanus shot, which prevents also it protects you from bacteria that causes tetanus. And then your immunization records also shows that you've been taking your flu shot every year, and that is a good thing. So even though we are not in the flu season yet, in a couple of months we'll be there, and I encourage you also to do that, okay?
Okay.
Good. So where do you live and who lives with you?
I live in an apartment with my wife.
And tell me about your medical history.
I have hypertension, high cholesterol, and type 2 diabetes.
So what brings you to the clinic today?
I'm here for a 6-month blood pressure check and medication refill of my lisinopril.
Do you have any pain or discomfort?
No, but I have a chronic cough that is very irritating and frustrating.
When did the cough start?
I think it started about 5 or 6 months ago.
How often do you have this cough?
I cough every day.
And when you cough, what comes out?
Oh, nothing comes out. It's just very dry and annoying.
Is it worse at any particular time of the day?
No.
And is the cough associated with heartburn or sour taste in your mouth?
No.
Is the cough triggered by exercise or breathing cold air or laughing?
No.
Have you done anything to treat the cough?
Yes, I've taken over-the-counter cough syrup and cough drops, but they were not helpful.
Is there anything that makes the cough worse?
I'm not sure.
Anything that makes it better?
Not really.
Do you have difficulty breathing?
No.
Have you had asthma?
No.
Is there anybody in your family who has been diagnosed with asthma?
No.
Do you sleep throughout the night?
No, I wake up several times because of coughing.
Has anyone been sick recently in your family, among your friends?
No.
And do you have any chest pain?
No.
Do you have any abdominal pain?
No.
Do you smoke, or have you been with people who smoke, or have you been exposed to secondhand smoking?
No.
And
I don't smoke, and none of my friends or family smoke.
okay. Have you been exposed to someone who has tuberculosis?
Not that I know of.
And have you ever had a mantle test, which is a test to check if you have a tuberculosis disease?
I had a negative tuberculosis disease years ago.
Have you had a respiratory infection, like the flu, recently?
No.
Do you have a history of respiratory problems, like lung cancer?
No.
Do you have any symptoms besides the cough, such as sore throat or fever?
No.
So, John, from the questions that I have asked so far, it appears that you don't have a post-viral cough infection. You also don't have post-nasal drip due to sinusitis, and you also don't have seasonal allergies. And besides, you also don't have esophageal reflux disease, gastroesophageal reflux disease, and you also don't have lung cancer. So I think that your cough is due to the lisinopril that, as you said, was given to you about 6 months ago, right? So when you were in the clinic 6 months ago, you told me earlier on that you were switched to your medicine, your hypertensive medicine was switched to lisinopril. And I think that is the side effect that many people get, and that might be the reason why you have this persistent cough, okay? So what I'm going to do is that I'm going to change your lisinopril to another medicine, and it is called losartan. You will take 50 milligrams every day. So you have to stop taking the lisinopril, okay? and that should help to resolve the cough. So now with your blood pressure, how well is it managed with the medicine?
I'm not sure.
Do you have any headache?
No.
No headaches. Have you had any blood pressure readings from the grocery stores, Rainbow, or from any Walgreens or any of those areas?
No.
And do you have blood? Have you been diagnosed of heart disease or kidney disease?
No.
No. Okay. Do you use any street drugs?
No.
And do you have problems urinating?
No.
How much fluid do you drink? How much fluid of water do you drink a day?
I drink about 4 bottles of water a day.
Oh, that's good. And do you feel any numbness and tingling in your feet?
No.
And have you had any surgery?
No.
No. And have you had any injury in the past?
No.
Okay. So, and you haven't been hospitalized for any reason, have you?
No.
Okay. So, and about your blood sugar at home, how often, of late, how are you managing? That's the question. How are you managing your blood sugar at home?
Well, with diet and exercise, lately I've been eating out a lot though.
You've been eating out a lot.
Mm-hmm.
How's your appetite?
I have a good appetite. I think that I do eat a lot.
So, and how's your bowel habit?
I'm very much regular. I go every day, sometimes twice.
When was the last time you checked your blood sugar?
I don't remember. I think it was a year ago.
Oh, have you noticed any changes in your vision recently?
Yes, I've been squinting and also have to get closer to the TV to see properly.
Tell me about how you care for your feet.
I just take a shower and dry my feet sometimes. Why? Should I do something extra?
Yes, you must wash your feet every day, and then also you must wear socks and change them every day. And besides, you don't want to ever walk on bare feet. You always want to protect your feet. And do you inspect your feet every day?
Sometimes I forget.
Well, since you are diabetic, John, you don't want to forget that. You always want to inspect your feet so that if there is any cut or anything, as soon as you catch that, you can call the clinic and then you can come in and then have it treated before it gets worse, okay? Because when you are diabetic, sometimes you can have a sore in your feet and you will never feel it until it gets worse, and that can cause you a lot of problems, okay? And then, have you noticed any skin problem of late?
No.
In any part of your skin? And you told me that you have been managing your diabetes with diet and exercise. Tell me about your diet.
I've been eating out a lot, and I feel like I've put on a lot of weight.
Yes, your weight has actually gone up from 180 to about 200 since your last visit. And your BMI, which is the measure of how your weight is in relation to your height, is in the range of 31. And that puts you in the category of people that we term as being obese. And you know, when you are diabetic and you have or you are also obese, the tendency to develop other complications is very high, and we don't want that to happen. So we will try to, we want to do something to check that your weight will come down. Meanwhile, your vital signs are good. You don't have fever, and your blood pressure today, as was measured, is very good. And your temperature, your pulse, and your respirations are all within normal limit, okay?
Okay.
So you have to do something, to lose the weight.
So what should I do to lose the weight?
Well, you have to stop eating out. You first mentioned that you have been eating out a lot, and that is not good for you. And but then, some people cannot cook and they eat out. If you want to eat out, it's fine. The only thing you have to do as you eat out is to make sure that you eat diets which are heart healthy. In other words, you have to eat more fruits and vegetables, and then by so doing, you are making the right food choices. So that will help with your cholesterol, and that will also help with your blood sugar too. And then with the exercise too, you have to be very consistent, develop a plan, whereby, say, 3 days in a week, you can, go for a walk with your spouse, or you can walk alone within the neighborhood. Excuse me. It doesn't have to be a strenuous exercise. You just have to take a walk, half an hour to 1 hour, and you don't want to be too tired about it, okay? Mm-hmm. And that might, eventually help with your weight as well as your blood sugar and then also your cholesterol. And besides, you might also benefit from a referral to a dietitian, which I will eventually do it, okay? Do you have any questions before I proceed to the physical exam?
No.
No, okay. So let's have you sit in the table there, so I will begin our physical exam, okay? Let me wash my hands, and you can sit up there and I'll do it right there on the exam table. Okay. Okay. So, with the exam, I'm going to start with your hair. Okay. Your hair is well kept. It's all well shaved and very good arranged, and there is no lesions. I don't see any lumps of your hair, and then there is also no scar or anything on your scalp. So that is a very good thing. It's normal cephalic, and that means you have the normal shape of the head, okay? And then I'm gonna check your eyes. So let me, with the eyes, where's my pencil? I have, oh, here we go. So I'm going to follow this pencil, okay? Don't move your head, just follow the pencil, okay, with your eyes. Good. Now just follow the pencil. Good. We call this aspella. That is your pupils are equal, and they are round, and they are very reactive to light and accommodation. Okay. So now I'm going to use this ophthalmoscope. The otoscope to check here. Good. Okay. So I want you to open your eyes. And then I'll just want to see the reflex. Good. Okay. Okay, good. So the cuspid disc, the retina, and macula are all intact. Okay. And your sclera is white, your conjunctiva is pink. I don't see any drainage, which is good. And good. I don't see any fluid or anything, and your eyes seems to be in good shape, even though like you said, you have been squinting on the TV, and then also you have difficulty seeing it much. You will go to the ophthalmologist to check into that, and I think that will help. Okay, so that will be of your eyes. Now, I'm going to check your ears, okay?
Okay.
Come on. There. Okay. So pull your ear. Is there any pain?
No.
Okay, any pain here?
No.
Any pain on your tragus as I push the tragus?
No.
And then what about the master as I push the back of your ear?
No.
Okay, so I'm going to check your ear. Yeah, good. And your tympanic membrane is pearly gray on that side, and there is no bulging, there is no swelling, there is no lesion, okay? And then I'm going to check this one too. And do you have any pain also here on your mastoid?
No.
What about on your tragus, this mercury? Any pain?
No.
Good. Your auricle, your ear is very also good in shape. Good. Okay. So both your ears are all Very good. And there is no lesion, there is no drainage, and there is no bulging, there is no redness. It's all pearly gray, and your very good light reflex over there too. Okay. Okay. So now I'm going to check your nose. Okay. But before then, let me. Do you have any pain as I push down here?
No.
No pain. Okay. So can you raise your head a little bit and then? Good. Good. Your nasal mucosa is very pink. It's pink, and there is also no drainage, and it's also good. So now, can you do put your finger on your nose, and then breathe in, and then change the other one. You just want to make sure that good. It's very patent. Okay. Now I need to look into your mouth. Okay. Look at your teeth, and you were talking about having a teeth problem with halitosis. Okay. Now say ah. Good. Okay. I see your tonsils. They are all pink, and there's no red, no inflammation there. Okay. And let me palpate, see your lymph nodes. Okay. The lymph nodes are also okay. Okay. Now let me go behind you, and then swallow. Good. Your thyroids are all in good shape. There is no thyromegaly, that means too big or anything like that. Okay. Good. So now I'm going to listen to your lung sounds. Can you take your shirt off for me, please?
Yeah.
Okay. Let me get to your back first. Okay. Take a deep breath.
All right.
Another one. Another one. Another one. Another one. Another one. Good. Okay. Then take a deep breath. Another one. Another one. Okay, now breathe normal. Normal. Okay. Okay, can you lay down now for me? Okay, so I'm going to inspect your stomach. Okay, and then listen to your lung sounds. It's the contour line is very round, and there is no bulging or anything like that. So you have to listen to your bowel sounds. Okay. Now I need to just palpate. Any pain?
No.
Take a deep breath. Hold it. Okay, now release. Okay, just to check your liver. Any pain?
No.
Okay, any pain?
No.
Okay. Any pain?
No.
Pain?
No.
Okay, let me check your liver, your kidneys. Okay. In this, I check your spleen, and there is no problem also there. Okay, you want to sit up?
All right.
Okay. So, okay. Just don't help me. Just check into your reflexes. Okay. Okay. Good. Okay. Now let's raise your hand for me like this. I am going to. Don't let me close it. Okay. Now push me. Okay. Now my fingers. I want you to squeeze it. Squeeze my fingers. Good. Okay. Good. Okay. And there was one. It's okay. So one more squeeze. Good. Okay, that's good. Now let me listen to your pulses here. Okay, good. So the exams are done. Let's have a seat, John, and then quickly go over a few things. Okay. With this exam, you are in March. I would say in March, better shape, but at your age, there are certain things that we need to do. Okay, so we have already gone over the dietitian, the food, we've gone over your immunization, and we have also gone over your, now what we need to do is that we're going to do some blood work. You haven't checked your blood sugar for over 1 year. We don't know how much your blood sugar is now. So we will draw blood to check your kidney function. We will also draw blood to check your hemoglobin. We will also, as well as A1C. A1C is the term we use, which it measures how you have managed your blood sugar, okay? And then we will also do chest X-ray, because of the cough. And then you want us to follow up in 1 month. And before I forget this, let's go back to the table with your shoes off. We call this monofilament test, and I don't want to forget that. Okay? It's very, very important for diabetics. So you sit down, take your shoes off for me. It's very important test, and then when you go home, anytime you wash your feet, take your socks. Okay. Yes. You want to test this. Okay. So do you feel it?
Yeah.
You feel it?
Yeah.
Okay. Do you feel it?
Yes.
You feel it?
Yeah.
Okay. So in 6 areas of your soul, your foot, we check to make sure. If you don't feel it, then it means you are not having sensation, and that can lead to diabetic problems due to diabetes. Okay, now you come and sit down, and then let's finish this off. So what you want to do now is that I want you to follow up in 1 month to check your blood pressure, and then we evaluate the treatment plan. You want to make sure that the medicine, the new one, the losartan, is working for you. Then in 3 months also, you want you to come in and check for hemoglobin A1C to help us to see how well you are managing your diabetes. And then in 6 months, I want you to come in for a regular follow-up, the routine follow-up like you're doing today, so that we will go over and then do more assessment. And I am going to update your allergy list to include lisinopril because it gave you a cough. Meanwhile, before then, you did not have any allergy to anything, right?
Right.
But now you're going to have an allergy to lisinopril on your record, so that nobody will ever prescribe it for you, okay? Because you don't want you to have a persistent cough. And do you have any question?
No.
Okay, wait, and the nurse will come and give you your shot, and then you are ready to go home, okay?
Okay.
Thank you, and nice meeting you, John.
Thanks, nice meeting you too.
Okay.